Hi, and welcome to the Future of Dermatology podcast. I'm your host, Dr. Faranak Kamangar, board certified dermatologist. We are here to talk about anything and everything dermatology related. You'll hear from me and my guests who are dermatologists, physicians, experts, scientists, residents, and medical students in the field of dermatology. We publish weekly, so if you like what you hear, hit that subscribe button and show us some love, and thank you for joining us. All right, today we have another really fun episode. We're going to be doing another Ask Me Anything, and our wonderful San Francisco Derm Society medical students have come up with a compilation of questions that I haven't seen yet, so this will be funny. They're going to test my knowledge for sure. I'm going to basically hand it off to Chandler Johnson, who we know really well, one of our veteran medical students, and then we have two new medical students that I'm going to let Chandler introduce too. So thanks again, Chandler, for doing this. These are always so fun.
Yeah, thank you, Dr. Fair. I'm excited to be back on the podcast. It's been a while since we've done one of the Ask Me Anything episodes. So I'm really looking forward to diving into the conversation. But before we do that, we definitely have to introduce two new individuals who are absolutely amazing. And I know that listeners will be hearing a lot from, in the coming months. So we have Andrea and Georgia, and I've been lucky enough to work with them for at least a month now. And I'm ending my year at UCSF in person, but I know that the research fellowship is in amazing hands with these two new students who are also going to be very involved with the SF Derm Society. So I'm going to hand it over to Andrea and then Georgia to just give the listeners a little bit more information about y'all.
Thanks, Chandler. I can get us started. Hey, everybody. I'm Andrea. I am a third/fourth year medical student at UCSF, just starting my research year. I have some big shoes to fill following Chandler and the previous team. But yeah, a little bit about me. I was born and raised in the Bay Area. I love everything about the Bay Area, and I'm so happy I got to stay for med school, and I'm excited for this upcoming year to just dive in and into learning about dermatology and life in general. And I'm super excited to be joining the podcast today. But yeah, I'll hand it off to Georgia.
Awesome. Thanks, Andrea. And yeah, thanks, Chandler, for the introduction. We're missing you a lot over on our team. But it's really, great to be part of this podcast. And I'm excited to learn more from Farah and the team. I am a UCSF medical student, and I'm also between my third and fourth year. And I grew up in Sunnyvale, so it's only about an hour south of San Francisco. And then I went to the East Coast for college. I went to Wellesley College. And I'm super excited to be back in the Bay Area for med school. So yeah, just looking forward to chatting more with you all.
Awesome. Well, thank y'all for introducing yourselves a little bit more too. And I know that this is a really exciting episode because y'all are really meeting Dr. Fair for the first time too, before y'all start to be more involved in future research endeavors and working together on the podcast going forward. So it's a really exciting episode. So I'm happy to be a part of this intro as well. And that being said, I've mentioned that we've compiled some questions for Dr. Farah, and y'all are getting to meet her as well. So I wanted to know if y'all wanted to start off by asking her a little bit about her pathway before we dive into more targeted questions and put her on the spot a little bit more.
Yeah, definitely. I'm super excited to meet you, Farah. And I would just love to know about why you chose derm, and a little bit about your career path and what's brought you here today.
Oh, absolutely. Yeah. And that's something I love talking about with medical students about, because it is such a long path, such a long, hard, arduous path, but it's so worth it at the end when you get there. And then in the past, we've even had talks with our residents who are still kind of going through the process as well. So usually what will happen with the medical students, of course, you guys will do your research year, and then you'll get into where Chandler's doing now, which is the applying to dermatology. So it's all such a fun field. And then when you get to the point where I'm at, you kind of forget all those stages. So it's so fun to kind of relive it with all of you as well, because you really remember all those steps, and it kind of makes you appreciate, all of the cool things that we get to do. But my background, I am also a Bay Area native. So really cool to hear that you both, and actually I went to Fremont High School in Sunnyvale, Georgia. So
Oh my God, I
did
went
you
to
go there
Fremont High
too?
School.
Amazing.
That's crazy.
Firebirds.
Yes,
And then
wow.
I
Oh my
went to
gosh.
UC Davis for undergrad, went there for medical school and residency, but did the UCSF fellowship like you guys are doing a long time ago. Back then it was with Dr. Ku, Dr. Liao, and then Dr. Tina Bhutani was the fellow actually at that time with me. And so that's been my path. And after residency, came here to the Palo Alto Medical Foundation, got involved actually with the San Francisco Derm Society when I was a resident. I think that was back, a while back now. So it's been almost a decade of working with SF Derm. And then here at the Palo Alto Medical Foundation, I'm the chair of our department. We do everything dermatology, medical, cosmetic, adults, kids. We have phototherapy units, clinical research. So the entire breadth of everything we love to do. And then the SF Derm, it's amazing to just meet all of our community in the Bay Area and our UC Davis docs, Stanford docs, UCSF, and then all the private practice docs, all the different centers, and then all the med students and residents who've been in the Bay Area who have left are still part of the community. So it's just amazing. So it's been a really, really fun path as well.
That's awesome. Thank you so much for sharing more about your pathway to derm, Dr. Fair, and thanks so much for your continued mentorship. And it's exciting to hear how much is going on out where you're practicing. So you'll have a really great fund of knowledge to draw from when we put you on the spot now for all the questions we're about to ask you.
Hopefully, but
So
you'd be surprised. Sometimes leaving residency, you know so much, and then as you go into practice, you learn a lot of practice management and practical skills. Sometimes the nitty-gritty details start leaving your brain. So we'll see. Hopefully, there's still enough in there.
I have faith in you. Okay, so I noticed Andrea has compiled some really interesting questions, some things that it was not even on my radar. So Andrea, if you don't mind, would you go ahead and, hit Dr. Farah with one of your first questions?
Yeah, I'd love to. And this is a question that I'm personally super curious about because I'm wondering if I should make the investment. So I'm hearing a lot online about like red light therapy, whether it's like by individual like wands or facial masks. And I know they range from like low prices to really high end prices. And so I guess I just wanted to hear what your thoughts were on its efficacy and whether you think it's a worthy investment.
Oh, yeah, this is a good question because biomodulation and biomodulation, basically altering the structures of our face and skin with using light, is one of my loves in life. It's very specific and it's so niche. And you guys will actually, through the next year, and Chandler knows because you spend so intimate time working with the phototherapy unit at UCSF, which has to do with all the different ways we use light in dermatology. I love this field and it's kind of crazy. I don't think people realize all the different things that we can do with the electromagnetic spectrum of light. And so, of course, everyone out there kind of always hears about ultraviolet rays and avoid that, and then infrared and all of these, the bad things. But then there's so much therapeutic effects into different focus light. Red light being one of them, which it can be anti-inflammatory, it can be antimicrobial. So there's definitely proven efficacy for red light. And I think it works. And it's one of those, especially with the over-the-counter products, they're not strong enough, I think, to cause too much harm, like burn your skin. Because the medical grade ones we have in our offices, like different levels of light and lasers, you really need to be careful with. You need to wear goggles and all sorts of things. But the ones at home are so kind of mild that you really can't harm yourself. So I think it definitely doesn't hurt to do them. Having said that, the milder you get, the efficacy drops. So sometimes you see the prices on these things and you're like, that's crazy for, what you think it would do. So they're totally, there's definitely benefits to them. I wouldn't spend a whole lot because if it's going to be like hundreds of dollars, take that money, go see a dermatologist near you and do something like in office. but yeah, I think the red light therapies, there's definitely lots of evidence for them for healing, wound healing. There's evidence for that. The anti-aging claims, I don't think, it helps build collagen and all of that. That I think is a little bit more hyped up than anything, but the anti-inflammatory effects are definitely well documented. And then we should actually one time do like an episode on lasers specifically, but then there's collimated light, where we collimate light to target a specific structure in the skin, which then opens up the whole laser world. So yeah, light medicine for sure works. The only thing with over the counter, I would just say don't spend a whole lot of money, because they really, if you see our devices in our office, and you can see the phototherapy unit or any of our lasers, they're like these giant things. We always have issues with space of where to store our lasers. So you can imagine if there's something that you like fit in your pocket or in a small box, it can't possibly generate that much power to do a lot. So that's probably a long answer, but yes, that's a yes for red light therapy.
Awesome. Thank you for sharing more. And I love that topic too, especially anti-aging. I feel like it's a topic that's really interesting to a lot of listeners, and myself included. And another thing that I've been hearing a lot about is preventative Botox. Us three, we're all in our, 20s, and we're, reaching the point where we're like, maybe we should consider something preventative, or maybe that's just me, but I've been seeing a lot about it, and I just wanted to see your thoughts on it.
Absolutely. Well, the good thing about all three of you, whether you want Botox or not, in a year or two, you're going to enter a dermatology residency. And what ends up happening is a lot of product around that you and your residents want to practice with. So whether you like it or not, you're going to be getting a lot of preventative therapies starting in about a year or two. Like we would have a new device come in, new filler, new Botox, and we'd be like, who's up for it? Who can we inject this into? So it kind of naturally happens for dermatologists, which maybe is a specific case study, like a cohort of a group of people you can follow and see how they aged. And I think most dermatologists look pretty good, like going into their 50s, 60s, 70s. So maybe there's something to be said about the preventive Botox. But basically the idea behind Botox, so Botox, of course, is a neuromodulator, and it stops your muscles from moving as much so that you're not able to make the lines on your skin, the famous areas being like the 11s between your eyebrows, the glabella area. The reason that happens is the muscles have been making that movement your entire life, but your skin starts to lose enough collagen, usually starts happening in your later 20s, like around age 28 onwards. You lose enough collagen where now with the same movement, your skin folds over. So then that's kind of where Botox comes in, is if you can get ahead of that and stop that movement earlier on, you don't get those super etched in lines that are then kind of harder to fix. But the other half of that is you really need to make sure that you keep up your collagen, because the Botox is almost like a Band-Aid to it, because if your skin is supple, has lots of collagen and elastin, and your extracellular matrix is really robust, you can delay, when you need to start doing the Botox. So preventive Botox totally works. Sometimes we're seeing patients come in way too young, like early 20s, and they're like, I'm here for my Botox. And I'm like, no. And I'm sure they're going somewhere else and getting it. But so there is like a little bit of it's kind of like those little kiddos you see now, like in Sephora getting their retina. You're like, no, too young. But so that you can go too far with it. But the idea is it definitely works. Yeah. I mean, starting earlier than you would think, especially when you start seeing the lines forming, or if the lines are starting to leave an indentation in the face, that's probably a good time to kind of start the Botox. But then building up your own collagen, start exercising now. That's the best way. If you keep up your muscle mass, keep up your bone mass, so important for women specifically, then you'll build up your collagen too, because everybody kind of focuses here, but really, the whole body's attached to the skin, and the whole skin is working together. So eating healthy, staying in shape, keeping up muscle mass, not stressing as much, but impossible with the route you three have chosen. But the good thing is you will have free Botox coming in about 15 to 18 months. So the stress will it'll balance itself out.
It's all worth it.
It's all worth it.
On that note, I have a follow-up question. Every time I go to the store, I see these giant containers of like collagen supplements. Are you in favor
Yeah.
of them, or do you think that they're unnecessary? Like, what's your opinion?
I'm in favor and I take collagen myself, but it's not like a magic thing. It's for sure
Mhm.
like not a like a foolproof thing to do, because it's basically they're peptides. So the collagen that you take are peptides, and they're made up of the amino acids that are that make up collagen. That you guys probably remember a lot better than I do, because you just have probably studied all of this in med school, in the extracellular matrix, and the amino acids needed, like the proline and hydroxyproline, to make collagen. So the collagen supplements do two things. One is if they're bioactive, and certain brands are and certain aren't. So you want to look for bioactive collagen. If they're bioactive, the peptide will actually absorb through your gut. It'll go to where it needs to be, and it'll signal, like it'll tell your body, hey, make collagen, because there's an abundance of this peptide. So it's a signaling active peptide. The other thing it does, if your stomach just breaks it up into lots of proline and hydroxyproline, then it's just more substrate for your body to use to make collagen. So it does have, and the other important thing is collagen is all over your body. It's like, I might be off on the number here, but I think it's like 20 to 30% basically of the protein in body, something like that. We could fact check that before we put it up, because I'm coming up with it on the top of my head. But it's so much of your body. Collagen is in your heart, in your joints, and it's everywhere. So, and a lot of people focus on, well, is it going to specifically get to your skin where you want it? But I think the whole point is you want your collagen to be intact everywhere. And then there are some studies with some specific bioactive collagen where they put like a fluorescent marker on it, and they chase the peptides, and they do see that it ends up in the dermis. So there is some evidence for it. There are specific types, and not to be like putting out brands here, but like Verisol collagen, for example, is a bioactive collagen, and that's one that is comes from a manufacturer, and then different brands of collagens have Verisol collagen in them. So that's one that has like a lot of evidence. On the other flip side of it, I would say, is you don't have to take collagen. You can also get it from like dietary collagen. You don't have to take it as a supplement. It's just usually kind of hard for most people in a diet to get enough of things like gelatin and bone broth and all this good stuff that you can just get lots of dietary collagen. You don't have to spend all this money to get like hydrolyzed collagen. And then if you don't have a good sort of diet and fitness, and so you're eating a lot of junk food, and on top of it you're just drinking and consuming collagen, it's not going to do anything. It's really like an additive to an entire like healthy lifestyle, and you're eating well, you're keeping up your muscle mass, collagen mass, and then it's like I would put it in the very, very supplement category. It's not going to by itself do a whole lot, and they're not inexpensive either. Sometimes those add up. So if you're going to spend a ton of money on that, maybe it's better to spend that money on like the gym or something else. So it just has to kind of make sense for the person, because a lot of times we'll have patients that come in that have very other unhealthy habits, but then we'll kind of try to ameliorate it with doing something like a supplement collagen. So but I do think there's, in the right place, if you're doing everything else, there's a little bit of added benefit from taking collagen.
So, in addition to these over-the-counter supplements that we see a lot of in store, another thing that we see a lot of is sunscreen.
Mm-hmm.
So I would love if, Georgia, if you could ask us your really interesting question that I saw listed.
Yeah, so this is super relevant now that, we're in sunny summer months. But something that I've been seeing come up on my Instagram and like social media is homemade sunscreen. Mm-hmm. And my initial reaction was like, how can that possibly work? And so I'd love to, hear your thoughts if you have any thoughts about that.
I've been seeing it too. I don't know why this got started, but there are a lot of good sunscreens at your drugstore. Yeah. So you can just go do that or order it on Amazon. It'll come straight to your house. And I know a lot of people are trying to be maybe doing the more organic thing. And like exactly like we talked about with collagen, if you don't want to take something unnatural in a supplement, you could just, eat it nutritionally. So I'm all about doing things kind of naturally when possible. But I also know the evidence that goes behind making a sunscreen. And I know how difficult it is for these companies to make the sunscreens, how like rigorous rigorous the testing is to come up with the number for like the SPF values, get FDA approved to put that SPF indicator on their bottle. It's actually very, very difficult to do. So I can't imagine, it's not impossible, but I can't imagine someone just like in their kitchen being able to replicate that level of accuracy. So, and the main thing is with SPF, we just don't want people to burn or damage their skin or damage their DNA. So I think if our goal is to do it the most efficiently possible, I would probably just trust a sunscreen that's kind of gone through the rigorous process. And our sunscreens are pretty safe. I know there's a lot out there. People are worried about them. The safest are probably our physical blockers with like titanium dioxide, zinc oxide. Some formulations can be a little bit chalky, which people don't like, but there's a lot of good formulations of them now that actually go into the skin pretty well. Those are pretty safe. Usually they don't, get absorbed into their skin. They really don't have any of those associated potential concerns of like endocrine disruption or absorbing into your skin that some of the chemical sunscreens have kind of been scrutinized for. So yeah, I've seen that trend, but I think just stick with what works. And if you really just want to avoid like putting anything on your skin, just physical clothing even works really well too. Yeah. So just UPF clothing, even just regular clothing. But if you get UPF 50 clothing, then you know that the fibers have actually been tested to know that it can keep out enough UV. So that's probably the most like proven, quote, quote, natural way to do it. Just kind of cover up and seek shade. But that's a really interesting trend actually. And you guys let me know if you find out more about it, because I've kind of peripherally seen them like, yeah, that's not good.
I'll try to send you a couple of videos I've seen. There's some like really big influencers talking about it.
They're all about it, right? And I think the Dr. Forum Patel, she was on one of our podcasts too. I don't know exactly what she said, but she had like a really funny post about this too, basically like with kind of reacting to some of those videos.
Yeah. Really interesting.
Go ahead, Chandler. I was gonna say we have a bunch more summer questions.
We definitely do. I just wanted to pause, because we're on the topic of, doing things more naturally. The people that might be interested in the DIY at-home sunscreen might also be interested in harnessing the power of the microbiome. And I saw, Andrea, you had listed a question that was also pretty unique if you wanted to ask Dr. Fair about this.
Yeah, I have been also seeing a lot on Instagram and TikTok about a lot of people using different things like normalizing HIPAA cleanse, like cleansers, and also like it's either like hypochlorous or hydrochlorous spray in order to like kind of rid off body acne, especially when it's hot and you're working out. And I know we are really getting into like gut microbiome and skin microbiome. And now with this movement of using a lot more of these like more traditionally like antimicrobial products, like what are your thoughts on using those?
Yeah, no, it's a really great point. And like HIPAA cleanse and hypochlorous acid have been staples of dermatology that we've used, and they're kind of getting really popular now. I do see, like, I think Grace posted HIPAA cleanse. I was like, HIPAA cleanse? That's like one of our, like, it's like kind of almost like boring to us. It's so, we use it so much. It's like going to the DMV or something. I'm like, oh, that's cool. That's cool right now. So, but the HIPAA cleanse is just a really, like you said, it's a very diverse, thorough antibiotic kind of topical that can be used. So it works really well for decreasing like excess staph on the skin, staph bacteria that can lead to folliculitis and like heat rashes, things like that can be seen. So it totally makes sense to do like after the gym. Some of our patients that are very acne prone or with a condition called like hidradenitis suppurativa, where they get like cysts in their underarms, growing areas like that, using these kind of antimicrobial, anti-inflammatory things definitely makes sense. But you're totally right. Also, it's like, what does this do to the microbiome? And HIPAA cleanse is probably even stronger than the acid. But basically, I think it's in certain areas used certain times of the week. It's fine. It's probably better to get rid of that like excess staph. And we know staph can trigger other things like inflammation and eczema. So we've seen it's actually kind of a good thing. Like even in infants, like with eczema, we'll sometimes do bleach baths, which probably sounds crazy to people, but bleach baths have really shown that they can kind of decrease the bad kind of staph almost on the skin, and then let the skin almost kind of get a homeostasis and harmonize and be able to build a healthier skin barrier. So I think there's a lot we don't know about the microbiome still, really. Like there's a lot of research being done. There's a lot of great research at UCSF, actually. I know Dr. Tiffany Sharchman's doing a lot of really cool, interesting research with the microbiome there. So I think we'll learn more and more. But so far, I don't think it's causing any harm. Like I don't think we're seeing a lot of dysbiosis or anything with these topicals being used. And they are super helpful. They can really decrease infections that might go on to require like an oral antibiotic. If your skin infection gets bad enough, if you need an oral antibiotic, then you're really going to mess up like the GI and everywhere else. So I think it's probably still helpful, more helpful to limit any infections or anything on the skin, so it doesn't lead to more trouble down the line.
Awesome. So as Georgia was mentioning before, we have quite a few summer-related questions for you, Dr. Farah. So if you don't mind, I would love to switch gears and start asking you a few of those. The first one I wanted to discuss with you is, it is the peak of summer right now, and a lot of people are traveling, and I'm sure in clinic you've been seeing people come in with potentially new rashes. So I'm just kind of curious, what are some of your more common summer travel or just summer related rashes that you're seeing more of this time of year?
Yeah, it's true. It's so seasonal, the rashes that we see in clinic. I mean, of course, you get a lot of the heat rash. You can get a lot of the less fancy rashes like intertrigo, where you have just irritation in the folds that can turn red, and then yeast can be a trigger. So a lot of that we see. For some people, heat can even trigger their eczema. For some people, it's cold and dry, but for some, it's heat, especially like dyshydrotic eczema. Sometimes with like excess sweating, you can get that, the type where you get like little bubbles on your hands. Those can flare more in the summertime as well. People are out more, so you can see things like contact dermatitis, things like poison oak, but also poison oak like reactions to other things that are out there in the nature. And then some people will come back from exotic places with some exotic things, like they got stung with like a jellyfish or some sort of weird aquatic dermatitis. A really fun one that, well, not so much fun, I guess, when it happens, but some patients might be like off somewhere and they might be maybe having drinks or handling some lime or watermelon juice, and it'll get on their hand and they'll get a dermatitis and hyperpigmentation in like a very linear fashion. So they come back and they're like, what happened here? But it's like very obvious. It's like where the lime might have dripped. So all sorts of things can happen this summer. All of our pigmentary disorders, of course, get a little worse. So it's like the worst time for patients with melasma, or which is like that mask of pregnancy, or that a lot of people don't have to be pregnant. They have lots of people get it. But that kind of just that very inflammatory type of hyperpigmentation that definitely worsens over the summer. So there are very specific things that we see for sure, like of all various things. But it's and a lot of the things that are caused by the sun too, like just photosensitivities. Some of our patients have conditions like BLEVA, like polymorphous light eruption, for example, or other photosensitivities we see a lot of, and they flare during the summertime. Some of our eczema patients even have photoallergies. They'll literally be allergic to the sun. So there's probably like I can list on and on what you can see in the summertime, but the main culprit as you can tell, is the sun and heat is triggering a lot of it.
Got it. When you mentioned the jellyfish sting, it just triggered like a very painful memory. I'm joining you guys from the Keys. That's where my parents live, and I was in the ocean before, and I fell victim to the jellyfish out there.
So they got you.
They got me. My heart goes out to the fellow victims.
What did you guys do? Did you have a...
Yes, I think that this worked for me personally. I used apple cider vinegar. We just had it at home. I don't know if that's something that y'all have heard of or used before. Maybe it was just, an old wives' tale that like helped me in the moment. Maybe it was just like I was doing something for the pain. And I was like, okay, I'm doing something. This is helping. But
apple cider vinegar is great. Yeah, it has so many uses. That's another, speaking of natural things that work. Apple cider vinegar has a lot of good uses.
Yes, I do take one of the gummy supplements of that. Not collagen, but the apple cider gummy.
Yeah, and then just get one combined with collagen and you'll be good to go.
Yeah.
Well, I would love to ask sort of a related question. Farah, you mentioned, that like patients with eczema, rosacea, have like their skin conditions often worsen during the summer and during the heat. Do you have any tips for how people can manage that?
Absolutely. Yeah. And sometimes it's hard, especially during like a heat wave, but staying cool as much as possible is probably helpful for our eczema patients, especially the younger kiddos that flare a lot with heat. We always have them kind of keep their area very cool, but without like drying too much. So then they don't have dry skin as well. One thing we'll even have some parents do are almost like pajama wraps. Well, they'll cool down one pajama, like almost like a wet layer of pajamas, put that on. They could even put on ointments underneath and then put on a dry layer of pajamas over the kiddos. It sounds really uncomfortable to like sleep with one layer of wet pajamas over and then dry one over, but it actually is very soothing and it helps to drive the whatever emollient you put on their skin, whether that's a medicated emollient or just a moisturizer. It helps to also kind of drive that into the skin and kind of cools the outer layer of the skin. So that works well for like the little kiddos who just in their sleep are just so uncomfortable when they heat up during the summertime. Rosacea and melasma, those conditions, just strict sun protection. You have to put sunscreen on every couple of hours. So whatever formulation you end up being able to put on every couple of hours, because sometimes it's hard to do cream over cream. So whatever ends up working, there are sunscreen, powders, there are, all sorts of different formulations. So I recommend to those patients, pick a couple of different ones, because at some point you're not going to want to put another layer of cream on your face, especially if you're like at work or somewhere where you just don't want like a thing. You might not care at the beach, you can just keep putting it on. But if you're like around other people, you might want it to be a little bit more cosmetically, look a little bit better. So there's lots of formulations. I have a lot of my male patients now totally doing the powder sunscreen. There was some opposition initially where they were like, this is makeup. I'm like, no, it's not. It's just sunscreen in a different formulation. So I think it's important for people to kind of look into the different ones because they might even end up liking it and using it, more often. So those are the main things. And then rosacea, of course, has all the other triggers too that they could try to minimize, but at least for the heat and sunscreen, those are kind of ways to try to keep things at bay.
Okay, fair. I have another question for you, especially in the heat. And, a lot of us are still trying to keep fit in this summer heat. I was wondering what your best tips were for preventing breakouts and also the worst one of them all, chafing, especially like with the arms and the legs. Yeah, I would love any tips.
Yeah, 100%. I mean, the breakouts we can start with first. Acne can definitely flare with all the stuff we put on our face. And I know we talked about let's put on sunscreen over and over and over again, but it's also really important to make sure it's a non-comedogenic sunscreen because you can totally give yourself really bad acne by putting on super oily, thick sunscreen kind of over and over again. And then you have sweat on top of that and occlusion and all of that as well. One thing I think it's very derm specific, but I do think I even rev up on my like retin-A a bit, my retinols, the glycolic acid, AHAs a bit over the summer too, being conscious of the photosensitivity aspect, but just knowing that just with sweat and exercise and all of that, your pores are going to get a little more clogged than they might at other times of the year. And you can sneak in some facials too. Like I'll have our RN do like a hydrofacial here and there. It's just a good way to kind of unclog all of that as well. But short of the hydrofacial, just getting any sort of acid, even just over-the-counter salicylic acid and putting it on for a few minutes and then moisturizing well after that as well. So just kind of making sure you're exfoliating, but then also doing a lot of like non-comedogenic products for moisturizer, sunscreen, all of that, just to kind of prevent the acne. And then acne can have a very nutritionally kind of related as well. So just kind of being careful with just decreased sugar intake and alcohol intake, which kind of is all year around, but just to kind of another thing to keep an eye on, which can trigger acne as well. Chafing is also a concern with, especially during the summertime, but we have like a lot of athletes that we see here that have like all year round concerns with that. So the main thing with that is just barrier, a lot of barrier creams. There's lots of different ones out there. Things like Aquaphor are still really, really, like true and tested. And then powders, if you don't want to have something really like oily on, like a petrolatum, you can definitely use like powders in the summertime as well. And then for like our athletes, I usually recommend even in certain areas, if they're around like locker rooms, things like that, maybe even a powder with a little bit of like an antifungal element in it, because there's so much of that stuff that goes around in the summertime as well, just to kind of try to minimize getting like fungal infections of the skin. There's been another trend I've seen on Instagram with like people showing their fungal infections on the face. They're like, what are people up to this summer? But those things are on the rise in summertime. They just, fungal yeast elements, they like heat. They like all the places where people are in the summer, swimming pools and locker rooms and all of that too. So, and then like the HIPAA cleanse that we talked about too, that can help a lot in just minimizing like folliculitis and bacterial infections.
Awesome. Those are really, really great tips, and I will definitely use some of those. I also love that you mentioned using like retinols and also like AHA, BHAs. I remember hearing this trend a while ago of skin cycling, like using your retin-A one day and then your AHA, BHAs another day. What is your recommended regimen for all of these different products that everyone's using?
Absolutely. And it really depends on everyone's skin type. Like say for my skin type specifically, I don't have super oily skin. I can irritate my skin really, really easily. So for me, it's really like, what can my skin tolerate at this point? So the number one thing is don't overdo it for your skin type. So a lot of these ingredients are out there. They're very hyped up. And then we'll sometimes see your eczema patients coming in completely flared because they were trying to do like one thing after another. So the number one thing I would say is when you're putting on things that are a little bit exfoliating, that might strip the top layer of the skin a bit too, just listen to your skin to how frequently you can use these things. And then over time, your skin gets used to them too, especially with the retinoids, whether that's retinol or prescription like tretinoin, your skin gets used to it. So whatever you start really slow and go, very, very slowly into getting used to it. Because otherwise, if you go really fast, you just get irritated and you stop doing whatever regimen you just started. But I think a good way to do it generally with like a retinoid, start a couple of times a week, tiny amount, like pea-sized amount for your whole face, and then just go up really, really slowly. That process could even take 8 to 10 weeks for your skin to get used to a retinoid. And I would say do one thing at a time. Like if you're starting things, just get that retinoid, retinol, tretinoin on board. You can continue that pretty much your whole life, except for times of like breastfeeding or pregnancy. You can continue retinoids. So I would get used to that to begin with. And that by itself is going to do a lot to build collagen and exfoliate. And then every once in a while, maybe once a week, twice a week, you can throw in some AHAs, BHAs. That's just for increased exfoliation. So I wouldn't necessarily be trying to do like something every single day, like glycolic acid every day or anything. It might be a little bit too irritating.
Love it. Thanks for those tips.
Oh, Dr. Farah, I think I need to work with you to come up with the regimen for me.
Me too.
There's so many options on the market right now. It can be a little bit overwhelming.
There's a lot out there, but there's really the staples. So you need your retinoid unless pregnant or breastfeeding. Or if you have really bad eczema and just can't tolerate, you ultimately have to listen to your own skin. But just a retinoid, a good sunscreen, maybe an AHA, BHA every once in a while. But really, if you have that down and a really good moisturizer, that's like 95% of it. Plus maybe a little bit of vitamin C and antioxidants as well. But you really, there's so much out there now that I think you don't need. It's a whole, it's more marketing than anything with the skincare industry.
Got it. So I wanted to circle back to a topic we were discussing a little bit earlier in terms of working out. So I'm one of those people that enjoys working out outdoors. I love taking my long walks, my hikes. And this question came to mind when I was doing a hike up in Mill Valley when I was still over in the Bay. And I looked down and I saw a tick crawling on me and I freaked out and I was like, okay, well, I didn't get bit, thankfully. I did a thorough check of all my hair. But I just wanted to know, like, what are ways that people can prevent these arthropod bites, in the summer months where they may be out hiking like I was. Yeah. And then also, in addition to things like ticks, leeches, because I spend a lot of time in the Northwoods in the U.S. So that's something I feel like isn't as talked about. So I wanted to see your thoughts.
100%. And, as much as we said the main barrier is like keep clothed and cover your skin. And there are even some clothes that have like embedded insecticide type of things in them as well. So you could go really far with it if you wanted to. But despite all of that, I feel like these little bugs find a way to get in onto your skin. The main things with the tick is exactly like you said, remove the tick as soon as you see it, because the tick actually, we're worried about with ticks, them like Lyme disease, the tick has to actually be embedded onto your skin for a long time before it can transmit the Lyme disease. So if you see it, just get it away from you and make sure all the tick parts are removed. Sometimes we'll have patients come in and we still see a few tick bites. We'll actually do like a little mini, almost like a punch biopsy, and remove it. If you think the tick has been on your skin for a while, maybe just come and see a dermatologist too, or your primary care doc for some doxycycline. And then sometimes we're able to, if you have the tick, even send it to the lab and check. They can check it for Lyme titers to see if the tick actually carried Lyme disease or not. So those are a few things that can be done. But really a lot of it is kind of like you mentioned, just be vigilant when you're out and just check your skin. Because even the main recommendation is just cover the skin. If you're going to an area where there's lots of things that can bite you, etc., just have most of your skin covered so they can't get onto your skin. But we all know that it happens anyway. So it's really being vigilant and then just checking your skin after a hike. And like you mentioned too, checking the hair, checking the scalp, just check everywhere. Make sure everything looks okay.
Awesome. Well, I think we have one last question, just to round out like our summer theme that we have going on. It was just the 4th of July. People have been grilling and like maybe lighting fireworks. Hopefully not here in California. But do you have any like home burn care tips?
Oh, that's a good one, actually. So the main thing is just cool down your skin as fast as you can, if possible. Those are like the right away, put some ice on it, just kind of deal with the primary injury initially, and then take a peek at it. If it looks really bad, go to the ER. That means, and by bad, I mean if it's kind of gone through the skin, if you can see any parts of your skin that look deep. So the skin, you have the outer epidermis, then you have the dermis that kind of looks like that shiny pink, when you have like a wound and you kind of just looks shiny pink. So that's still dermis. You're still probably okay if that's as far as you are. If you're seeing like a little bit of fat protruding through, like you've gone below the dermis, you're in your subcutaneous fat, or if you're seeing muscle, anything like that, obviously those are, more advanced burns, just go to the ER. Those need a higher level of care and antibacterials. But assuming they're like superficial burns, you're just going to treat it at home. The main thing is going to cool it down first. And then the healing phase, you could, if your skin's intact, you could put some steroids on it. Higher level steroids you might want to do along with a doctor, but you could maybe try a little bit like 1% even hydrocortisone, just to try to calm down the inflammation, the redness, so it doesn't pigment as much. Probably even more important for like skin of color, where any level of pigment redness will probably lead to like really dark pigmentation that takes a long time to go away. And then the other types of wound care are really just things like Aquaphor, or if you have a prescription for like Biafin or other types of just barrier creams and wound healing. If it's a little bit deeper and it gets into the dermis or that kind of pink area, sometimes burns can scar, maybe like a little bit more elevated or raised. In that case, you can, after maybe like a week or two, you can start doing some silicone gel over it, just so you don't get like a texture change. Those are little silicone gels that you can roll on, or like little tapes that you can buy and just put on the skin as well. And then a lot of sunscreen. So sunscreen is going to really help to prevent pigmentation and healing from all that. But yeah, but you're right. Like it's better just to avoid the fireworks and the home fire injuries.
Agreed.
Well, thank you so much for your time, Dr. Fair. It's always so fun chatting with you and learning from you. I always walk away from an episode with something to look up or something to investigate. So I'm grateful for your time, and it's been a really fun episode with all of us getting to meet and chat. So thank you again.
Absolutely. I thank the three of you as well for all the wonderful questions. And Chandler, you always do an amazing job of hosting these episodes. So thank you to all three of you. I'm so excited to see all the amazing things for all three of you this year. Chandler's going to be applying, so we need to follow that journey. And match day, I presume, is somewhere in March of 2025, Chandler. So
Yes,
we'll be working towards that day. We'll have some exciting, we should do another podcast then for everyone to see how that process went. And then super excited to see the research projects that Andrea and Georgia start this year as well. So thank you guys. Thank all three of you for all the time.
Thank you.
Thank you.
Thank you so much. Yeah.
Thank you for listening to the Future of Dermatology podcast. Remember to hit that subscribe button and share the podcast with your friends. The more you share and subscribe, the more we'll be able to grow and share our dermatology knowledge. If you have burning dermatology questions, feel free to leave them in the comment below, and we would love to address them in a future episode. And please note that this podcast is not intended to substitute for medical advice from your doctor.